What's up, everybody? We're back again on a regular scheduled episode of Ask Chad Grassy Logic. Today, I have a special guest with me, Duane Boise. Thank you so much for joining me. And also on the side, Gino is going to be chiming in a little bit more, so you guys will be able to hear his voice. He doesn't have a camera or anything yet, but
well, I could.
We could. I don't know if the budget's calling for it. But we'll see where that goes and everything. Something we're trying a little bit more, let Gino kind of chime in, and also it kind of gives us a chance to get a little bit of research going on off camera, because he can do it while I'm sitting here, entertaining our guests. So and you all is listening to us as well. So Duane, thank you so much for joining me today. Today's going to be kind of a bit of a right at the throat kind of episode. It's going to be kind of a heavy conversation, I would think, but more or less we're going to be really reaming into the federal government. So without further ado, let's go ahead and start the episode. But Duane, before we get into like this whole thing, could you please give an introduction of yourself?
Thanks, Duane Boise. I'm the president and CEO of three companies: MMJ International Holdings, which is filed for FDA 2 IND clinical trials, one in multiple sclerosis and the other one in orphan. The agency has awarded us a orphan designation for Huntington's disease. The second company is MMJ Biopharma Cultivation, which applied to the DEA in 2018 to grow pharmaceutical cannabis to support the clinical trials. And the third company is MMJ Biopharma Labs, which has received a Schedule 1 analytical lab license from the DEA. So anyhow, I have managed for the past 7 years these entities to the point where we are now, unfortunately.
Yeah, the unfortunate part is, people are probably like, what the hell is he talking about? So we'll get to that part, and we'll figure out everything that he means. But thank you so much for the introduction. But before we, really dig in further, what really got you involved with cannabis in the first place? I guess we'll, revert back to a few years back.
Well, initially, my father was in law enforcement for 40 years. He retired, in a sense, passed away, but both my parents passed away from Parkinson's disease. We're not studying Parkinson's because our focus is primary on orphan diseases. Orphan is a designation that the federal government, the FDA, gives you for a minority population that suffer from a particular chronic disease. What that benefit does is create a de facto patent for our drug once approved. It gives us tax credits, and it gives us about $1 million to $2 million to offset the cost of doing the clinical trials. We also get expedited treatment through all our filings with the FDA, responses and so forth.
Oh, nice. So, the kind of thank you for the background in that for sure. And all that. So, well, without, further ado, I guess, let's dig into it. Before we kind of confuse people though, can we kind of explain what the Schedule 1 licensing kind of does and means? Like I've explained it before on the show, but having someone who's, gone through the process themselves, it'd be better for you to explain it in better terms if I haven't used any better terms in the past.
So there's two. The scheduling is per Congress under the Controlled Substance Act. And the DEA is to follow that Controlled Substance Act. And they put the most harmful drugs or addictive drugs in Schedule 1 and then Schedule 2 and so forth. On Schedule 1, the Controlled Substance Act is tied in with the United Nations Treaty, and it really dictates on what is required to get qualified to handle those schedules of drugs. Mm-hmm. In our case, we have a Schedule 1 analytical lab license, so the DEA has already acknowledged us, our team, the facility, and awarded us that designation in the lab, but refuses to do so in the cultivation. We speculate on why. We haven't gotten the answers yet, but we will. And you see, in our process, we started following the federal playbook of the schedules. And what the law says is if you're developing a pharmaceutical and you're working with the Food and Drug Administration to get drugs for chronic diseases, that the DEA has to expedite and give you priority over the approvals to get you through that system. It's right in their mission statement.
Yeah.
Obviously, they haven't abided by that because there's been 7 or 8 federal registrations issued, which we'll get into a little later. A lot of it is all arbitrary and independent because those other companies had no filings with the Food and Drug Administration to manufacture a drug, which was one of the criteria.
Mm-hmm.
And in our case, we had worked it from manufacture the drug. We're delivering the drug in a soft gelatin capsule. So if you think about it, we're taking specific extracts from specific marijuana cultivars and mixing that into the soft gelatin capsule for final dose delivery, which is the federal government's definition of a medicine, right?
Mm-hmm.
Final form API, active pharmaceutical ingredient in a dose form. And that's what we've created. We've worked for years on getting this process, and it entails a lot. How you grow the plant, the conditions, how you extract it, to develop the protocols, which we've done, to getting that product into the FDA under their guidelines. It's called the Botanical Drug Development, and that is like our Bible. And that's the federally legal way to do what this business is struggling to figure out. The states have fractioned off and gone out and done their own thing. Again, it's still federally illegal, right? But the government has turned a blind eye on that. In our case, we stuck into the FDA, the federally legal, and it's all about the development of a pharmaceutical. So that's the differentiation. Now, the Schedule 1 is the hardest because it has all sorts of, in some cases, ridiculous controls over who's handling it, who's getting it, the quantities. In our case, and we think why they're bucking up against us so hard, is when you do the analysis of number of pills to the patient through the clinical trial, I need the fill for that pills. And in order to get that fill, we had to calculate the amount of real estate we would need to grow X number of plants. If the FDA approves our drug, which we believe they will, I need 1 million square feet of marijuana with a federal license. There's nobody even doing clinical trials, let alone growing in the United States, even though they have the registration. And I think the most egregious, next to bright green, which as it appears is not so bright, Royal Emerald in Palm Desert, California. Royal Emerald bought out a Kmart building, spent $4 or $5 million on rehabbing it into grow rooms, got awarded the federal license, turned around and borrowed $17 million at 50% interest. Payments are $178,000 a month. The CEO of the company picks up the phone and calls the DEA quota section, and the conversation goes like this. Hi, I'm so-and-so calling from Royal Emerald. We'd like to import 30,000 plants in from company ABC. They get a company from England that ships 10 plants in as a trial run. All of them show up dead. So they decide that's not a good idea. Let's go to Canada. They go to Canada, get all the arrangements set up, and the DEA says, well, do you have somebody doing a clinical trial? No. Next question was, do you have a researcher that needs that many plants? No. Well, why are you ordering 30,000 plants? Oh, well, we just want to grow it and test our systems and do experiments on the plants. Well, sorry, we can't do that. How about if we give you a permit for 10 plants?
Oh, wow.
So now they all this massive investment ready to build out to meet the needs of research in the United States, and they can't get quota. Yeah. In our case, we can get quota because we're doing the clinical trials, and that's the way the system was built, right? Yeah. So now, I don't know if they're not in bankruptcy yet, they're close to it. Bright Green is in bankruptcy, and all the other ones that got the award have no revenue, so nobody's growing any significant amount of marijuana.
Yeah, because it costs money to grow.
Yeah, the whole thing was designed as a scam to fail.
Yeah.
In our case, we knew what the playbook was written. We followed the law, and now they're just making up stuff to block it and make sure that this gel cap doesn't get out, which it will. And we've already figured out a workaround. So they're not going to stop us regardless of what they do. But unfortunately, it can't be done here currently in the United States, which is evidenced by the most recent press release from the Veterans Affairs concerning their study about post-traumatic stress disorder.
Yes.
The VA is going out of the country.
Yeah.
To get its extracts.
Really?
Why?
I was wondering about that, because that's actually from Albuquerque, and the VA in Albuquerque.
Yes.
They're the ones doing that study, and I actually covered it last week, and I was wondering where they were going to get that cannabis, if it was going to be from one of these. I think I even asked that during the show last week, Gino.
Yeah, they're out of the country sourcing it, and here President Trump is talking about pharmaceutical manufacturing, keep all the development in the United States, and our own Veterans Affairs has to go out of the country to source a product that we should have had 7 years ago.
Yeah. Yeah. And then, like just before the show, you and I were speaking, and I got information about the DOJ. Gino's keeping eyes on the appropriation committee right now that we were talking about beforehand. There's a bunch of stuff at the federal government level that's going on kind of behind scenes, guys, that, is small things, but they're important things. This appropriations committee is really, going after the funding. So that way they can kind of go after the states more for our cannabis and medical cannabis and stuff like that. So it's unfortunate that they're kind of going that route. And now the DOJ announced it's withdrawing a bunch of rules and stuff like that. That was, going to expand some cannabis things. So that's unfortunate. But if you go to certain websites, it tells you otherwise. It's really confusing, what's going on. So, the fact that your guys are dealing with this too tells me that maybe there's something even bigger going on too. Because this is like a whole circus from the very top to the very bottom on different levels. So. I'm kind of confused by what's going on by the federal government right now, to be honest. I don't know about yourselves.
Well, having followed the playbook to a T, we're extremely confused because coming from a law enforcement background, right? The law is the law, you follow the law. And here you have the major law enforcement not following the law. They make it up as they go. They move the goalposts. They change the rules. They do whatever they feel like because they feel that they can, and nobody's holding them accountable.
Yeah, and they feel like no one will hold them accountable because they're whatever's on their side. And that's
I'm doing all I can do to expose it. I'm actually calling people out in the DEA. They took Trump's early buyout to retire because they saw this coming down the road. But the question still remains: why did they block it, and did they have the power to block it? Was it a small group of 4 or 5 people in terms of the DEA in the diversion department, or was it over them that they were being told to block all this stuff?
Yeah, and let me know when you get that info.
Well, we're taking it to court. I mean, we served a notice on Terry Cole in the DEA last week, basically saying, "Hey, we're only giving you so much time to respond to this. If you don't respond, we're taking it into the appellate court."
Nice.
Which we will probably by December.
Yeah. I'm glad you guys are doing this because it needs to be held accountable somewhere, and unfortunately, it's probably going to have to go through the courts heavily for some kind of budge to happen on this front because it seems like the fuckery isn't going to stop anytime soon with the federal government. That's an unfortunate term to use, but it's really what's going
Accurate.
on.
Yep.
Yeah, it's just a bunch of foolery going on. We have people really wanting to do great things with cannabis, either it be studies or trying to figure out medicines that come from it, and it's being blocked left and right. I can't say if this was going to be the same case with a different administration, but with the current one that's going on, this is the case, and that's the unfortunate part. And we have to call it out for what it is. And I hope that something comes from that court case. I'll be keeping tabs, for sure, because I really want to kind of expand more on this story because no one's really covering this side of things of what I've noticed. When I dove down this rabbit hole a couple of weeks ago when I met Duane, I was like, why is there only so many limited articles on this? And I found the article that led me to you, and I was like, there was a lot of information on this, and this sounds shady as shit. Why isn't this on anyone's radar yet? This is kind of huge news. And so, that's why I'm thankful for you to come and your willingness to come on and talk about it. So, I mean, let's expand on it more further. Let's dig in deeper on this too, and kind of figure out more. So, I mean, what other information could you share with us on this whole thing going on with them?
So we applied in 2018, and there were 50 some odd applicants total. In December of 2020, the DEA came out with the final rule.
Yeah.
And in that rule, it said anybody that's in the state business in hemp, you're out. So that eliminated a bunch of people.
Mhm.
And then they said that if you have a license in the state, any state, we deem that you're not responsible because you're operating against the Controlled Substance Act, which is federally illegal. So you're out.
Yeah. Yeah.
So that left about 20, 25 of us standing. Then another part of it mentioned something, and that took it down to about 15. So I think we're about the 12th in line. And they started issuing the registrations, and we were noticing that the registrations that appeared to be going through much quicker were out in your section of the country. And what I learned is that the section chiefs or commanding agent of each division, they did whatever they wanted to do. It was arbitrary. So they had to do all the initial investigations. You had to pass through all the security stuff, which we did, the cameras and all that nonsense. And then they would move the application into DEA headquarters. They would sign off on it and start issuing the registrations. When we started seeing the registrations coming out, those registrations were lacking because none of them had filed FDA clinical trials. None of them were doing any studies to help the American public per se, but it was just very vague and generic. As it turns out, none of those people are growing any amount of marijuana today. Several of them are out of business. Bright Green has declared bankruptcy protection, which was a big fraud in my estimation. But, why did the DEA allow all that to go on? And then when it came to us, they just kept moving the goalposts. And we couldn't figure it out. I have people that are retired from the DEA working for me in senior capacities, and they can't figure out. They're just beside themselves as to the activities because these people were part of the decision-making process under different administrations. Anyhow, we will find out what's going on. We will get to the end of it. At the end of the day, we're one of the last ones standing. I think we're one, if not the only one of a very few in front of the Food and Drug Administration, definitely with an orphan designation, which is difficult to obtain. And, we're going to survive this and we'll figure it out. I hope we're not the last guy standing, but we have to do what we have to do, right?
Yeah. Yeah, 100%. And, we have to continue to fight, even if it feels like, it's a losing battle. But at the same time, sometimes miracles happen.
The thing that gets
Hail Mary for a reason.
The thing that gets my attention the most is the pattern of internal to the DEA of deception. Now, I don't know if it's mismanagement because they're just, you can't fix stupid type of thing, or if it's intentional, let's just mess with these people because we don't ever want to see this get out there. And they feel like they're protecting the American public from our gel cap potentially coming to the market. So why not shut it off at the knees so they can't get the essence of the gel cap, right?
Yeah. And, are they doing this with any other, kind of cannabis related product, like that, there's being developed or anything? Do you happen to know?
We're following the playbook of GW Pharmacy, which sold out to Jazz. Okay. GW sourced their biomass out of the country and developed their API out of the country to the point where they had the final dose form of the medicine for their gastrolytics disease. And then they shipped it from out of the country in to do the FDA clinical trials.
Yeah.
We, on the other hand, said, hey, this is a U.S. project. It should be done in the U.S. It should be manufactured in the U.S. And that's the road we chose. Was that a mistake? Maybe it was. The fat lady hasn't sung yet. But I've been at this for 7 years. Most of the attention has been on the development. Thank God for Canada, because we did all the initial development of the product and shipped. The DEA gave us a permit to ship highly concentrated THC, CBD, and other stuff from Canada. Health Canada gave us a permit. DEA matched the permit, and we shipped to a gel cap manufacturing company in the United States, and we've worked with them for several years to get the gel cap manufactured. And then, a lot of science goes into that. I mean, we had to do stability studies. We had to make sure that the essence of the gel cap didn't change from the soft gelatin or the color of the gelatin. I mean, a lot of work went into it.
Little tiny things, huh?
Yeah, it got very scientific. But at the end of the day, we can reproduce what we have within very tight tolerances. And every time you take our gel cap, it'll be the same thing each time and every time you take it, which is a problem with the state businesses, because you don't have the science backing it up to get reproducibility of the product. So if you take something one day and it helps you for whatever you're taking it for, and the next day you go back and it's product A, chemically it's not product A.
Yeah.
Because the state operators don't, either the growers and or the operators aren't within those tight tolerances.
No, and you're 100% correct, and I've said this before, even on the genetic side, we're about 50 years behind the regular agricultural industry when it comes to stability and in our genetics. And so, the growers haven't caught up yet. The manufacturing hasn't caught up yet. But, if you have the means and the know-how and everything, the science and everything of, you could be able to figure that out. And it's cool that you have, because that's one thing that I've told people is, the consistency in cannabis is something that we're going to have to figure out through time. Because, a good example I told everybody is when you open up a Coca-Cola, it tastes like Coca-Cola everywhere in the United States, right? Doesn't matter if you get it in Pennsylvania or New Mexico, it's going to taste like a Coca-Cola. Or if I get a Sprite, it's going to taste like a Sprite. Now I know we get the whole Mexican Sprite, Coca-Cola thing, argument, whatever.
Right.
I'm talking about within the nation. But the consistency is a lot better. There might be a little tiny difference, but the consistency is a lot better in that sense, because you're right. I can take a Jack Herrera from a dispensary across the street, and I can go to one downtown somewhere else. They're going to have two different cultivars of Jack Herrera. It's not going to be the exact same. So the fact that you guys have been able to do that is great. And the fact that the DEA is hindering this stuff now kind of worries me, because, is it just for a certain amount of people that they're doing this, a certain group of people that they're allowing to do this is really what it kind of feels like, because why wouldn't we allow more people to get into this? Because we need that innovation. You know what I mean? You need the different players in this to make it great.
I don't know. Their mission statement is to not hinder the development of a pharmaceutical for the American public that's in need. So here we have the Food and Drug Administration awarding us an orphan designation, accepting our protocols, accepting 2 clinical trials, one in MS and one in Huntington's disease. And then you have the DEA cutting it off at the knees by not allowing the drug to be developed in the United States. So when President Trump comes out and says he wants to move the pharmaceutical companies back into the United States, it's not so much the pharmaceutical companies wouldn't do it in the United States. It's the DEA that's blocking it. He's got to fix that bottleneck before the pharmaceutical business can get back here and prices can come down, and then we're in control over our own drug supply. So we fall into that category. We're very niche because we're dealing with the extracts from the marijuana plant, which is still Schedule 1.
Yeah, which it shouldn't be in the first place. We know the CSA is highly flawed in what's on there and not on there. And I kind of feel it's one of those things that either it needs to be abolished completely or cannabis removed from it at least.
It's too deep, so they won't abolish it. And I don't. It's my opinion from my knowledge that they're not going to reschedule and they're not going to deschedule. If by chance it does go to a 3, it's still in the Controlled Substance Act, and that can be interpreted with a lot more ramifications serious against the state operators. Because if you read the law in the Controlled Substance Act, that means anything in the United States produced has to go to a pharmacy, and the prescription has to be written from a doctor to control it. So how is that interpreted with the state businesses?
Yeah. And then you have the question is, are we going to have Schedule 1 activity still because of the recreational stuff? will that even not be qualified
That's
with
correct.
that? So they will have this confusion, like, okay, we have, Schedule 1 activity, Schedule 3 activity, and then you have hemp over here that's totally federally legal and not scheduled at all, and like the only difference between that is a THC percentage. And so we have all this confusion going on, and no way to kind of, that I feel anyway too. I feel like we're going away from putting everything back together, and we're separating it again.
Yes.
Like further from each other than what already was. And like I'm kind of with you. Like with the events that's happening in the past few days. And Gino, I don't know if you've noticed it too. It just feels like we're drifting apart from the progress that we've made, and we're kind of going backwards. And it's not a good backwards. It's kind of going fast backwards, and really, really scary.
I was just curious about, is it really maybe the deep stigmatism that has, or is it just really something like you said? Because even pharmaceutical companies, big guys that are out there still have to get some of that stuff done, outside of the U.S. So is it more of a, big pharma type thing or a government bureaucracy thing, or is it that stigmatism against cannabis itself?
I think it's a little bit of everything.
Yeah,
it's a little bit of everything. I was told by some people close to it in the agency that there was a bias, and that Ann Milgram wouldn't do anything with marijuana to see it get out of the gate because of the conflict that the agents have lost their lives, which is a sad thing with the cartels over marijuana. But the lack of thought process of that statement alone is just ignorant, because if you're manufacturing a pharmaceutical, that has nothing to do with an agent that got killed in Mexico, right?
Well, the fentanyl crisis itself, you can still go to a pharmacy and get prescribed fentanyl, but all of that still is coming in. So that doesn't make any sense at all either.
That's correct. That's correct.
Yeah.
So, they talk out of both sides of their mouth, and when it's convenient for them, they try to take a broad swipe at everything and lump us in with God knows what, right? Illegal Chinese grows in Maine. They're letting that go on for years, and they're blocking us from moving forward.
Yeah, we had illegal Chinese farms here in New Mexico. We actually still do. They shut some down last year. They kind of just propped themselves back up because we have a lot of reservations here, and those are sovereign nations, so they prop up on the reservations, and it's a lot harder for the federal government, state government to really do anything.
Right.
And they're sitting there, well, our hands are tied. I was like, well, you guys seem to have them untied when it comes to screwing us over on other things. So well, what the hell's the holdup here? So to me, yeah, it's a little bit of everything. A little bit of corruption, a little bit of bias. Maybe a couple of splash of some side money here and there too.
Well, yeah, they can't go after the Chinese illegal grows, but they can sure as hell catch you at the border checkpoint.
Oh God, yeah. So we deal with inland border checks here in New Mexico, and they've been taking our cannabis, and I'm like 30 minutes from one actually, and so that's like a big thing. You have all this illegal activity going on, but they're harassing us who are following state laws. We have the paperwork, it's tested, etc., and still gets taken.
Yeah, we even had a former colleague get his car taken from him.
Yeah. A couple of my friends.
Really?
Yeah.
That's
bad
just
down here.
It
is. It is. And then it's not getting better. I keep hearing stories just about every couple months, every few weeks that we lost a couple pounds. Yeah, one of our old colleagues that used to work here at the radio station, he started working for a cannabis brand, and his vehicle got taken. They took the money, they took the product, they took his own personal vehicle. I think he just got it back a couple of weeks ago. So it's a big old mess, and like this, like the title says, this is a monopolized prohibition right here, where only a few people are able to operate and really, profit off of this, and it's not, the people themselves, and some people like you're really trying to create a medicine, and that's the unfortunate part, that really upsets me, is the fact that they're throwing all this BS and all this other extra stuff at you guys when you're just really trying to operate. And then you have Bright Green over here in New Mexico, just trying to scam people out of money and, have this huge facility that's never been used and, won't talk to anybody. And, now then I talked to you and I find out, a couple of weeks ago that they filed for bankruptcy and, they got out of the cannabis industry altogether. So who knows what's going to happen with all that stuff? Because they were promising jobs. They were promising all kinds of shit. Like, it seemed too good to be true. And I kind of took it as that. And I was like, we'll see. And it never materialized. And now we're learning exactly why, and they're not the only, people that are kind of dealing with issues, but it's unfortunate that the ones that are doing it the wrong way kind of got the licensing too, and you guys got kicked out on the production side. I'm glad you got it on one side at least, but the production side, that's unfortunate because it makes it harder to study and make your drug and everything.
Well, forces us out of the country like the VA, right?
Yeah, exactly.
I mean, we know where to go to get our cultivars. We know where to go to get the cultivars turned into our API. And then bring it in as a final dose form. They can't stop us, right?
Yeah.
But why? I don't get it.
I don't either. Like eventually, you with enough fighting, you're going to be able to do it. But like, why? Yeah, like why are we doing all of this? Like, I am so confused. With the DOJ, what they're doing. The DEA, and they've been fucking around the whole time. And them doing their thing. It seemed like the only one who had a little bit of sense was HHS last year and FDA a little bit. But even then, like, I can only count on them so much. And so far. So yeah, I'm just so confused. Like, our federal government isn't making any sense right now when it comes to cannabis, and that's unfortunate to say, but I hope something else changes. And Duane, I hope more good news comes your way, and I hope that this process gets a little bit easier. But I also hope that you keep me updated as well what's going on.
Sure, I got to say that the FDA has been working nicely with us.
That's good.
We've submitted a ton of research and development to them. They've come back with really smart questions, sincere, and we've answered everything that we could appropriately. Because we have the orphan designation, they have 30 days to respond back to us when we submit something to them. So in the development process, right now, as we sit there, we have what they call a CMC hold on us, which is a chemistry hold. And we have to clear up some of these questions in the manufacturing process, which we have and which we're capable. Nothing that they've asked us is unreasonable that would stop us from moving forward with the development of the soft gelatin capsule.
That's great to hear. And I kind of figured the FDA would be a little
encouraging. Yeah. The DEA, on the other hand, they don't talk much to the FDA, as I've learned. And their intentions are a little bit different.
Yeah, and I kind of got that gist many years ago, but it was shown full-fledged once HHS came out with their decision of we want to go Schedule 3, and the DEA is like, well, maybe, probably not, because even with the other administration, they were still doing fuckery. They were still trying to make sure that we don't have the right people during the hearings, and there's more anti-cannabis people that are allowed to speak, and this and that, and they were really stacking the board against us, and only allowing.
Well, they would do it for political reasons to make it look like they were advocating for it, but indeed they weren't.
Yeah, and I kind of feel that's kind of what's been happening in the past few weeks. Is the pandering to the cannabis industry to kind of get us to calm down while all this other fuckery is going on behind the scenes. Including issues like what you're dealing with. That's gone under the radar completely, even through myself.
What I can say is, if you've been following the rescheduling issue, they were forced into the administrative law judge court system, right? Yeah. And we did a bunch of research on that, and because they were issued a show cause order to us on why we think they should issue us the registration, and they started to go into it's a quasi court system, but where it's flawed is the administrative law judge works for the DEA, well, the DOJ for the DEA. Their offices are in the same building. When you get the judge to give a ruling, whether it's a yay or a nay, that ruling goes to the acting administrator of the Drug Enforcement Administration, which is Terry Cole. Yeah. And so the judge could rule yes in favor of rescheduling, go to Terry Cole, and he says, I don't like it, denied.
Yeah.
And now you're fighting different battles. So that whole process is unconstitutional. There was a case in the Security Exchange Commission, Jarsky versus SEC, and he took it all the way to the Supreme Court. And the Supreme Court basically said that it was a kangaroo court. They didn't have authority to do what they did, and that it denied Jarsky of his free right to a trial and independent judgment. So they reversed the whole SEC decision. We took that case and filed the same thing with the DEA and got the judge recused. filed a federal lawsuit against him in the state of Rhode Island. And then on a positive note, Pam Bondi came out and said, look, we agree with the Supreme Court, and we're not going to defend these constitutional challenges anymore, which means we won.
Yeah.
When she came out with that ruling, the federal judge in Rhode Island said, okay, I'm going to dismiss the case, but I'm not going to put an injunction against the DEA from pulling you back into that administrative law court. So very quickly, the attorney in there, Arati Haig, her name is, and she's got violations with the Bar Association in New Jersey, but yet she gets this job. And she starts filing motions in the administrative law court. When the Supreme Court has deemed that it's unconstitutional, the Attorney General says we're not defending the cases. She picks it up right away and tries to jam it through. The judge gets it. This is the same judge that's hearing the reschedule. I call him McLooney. And
that's a good one.
McLooney takes it, and they only heard half of the case, which was basically, hey, what date did you file? What happened? And we stipulated to all that. They didn't get into all the other particulars on our case. And he says, I'm going to reconsider this and rule in favor of the DEA. MMJ, you're out. Never hearing the case.
Holy shit.
And then retires.
So
so now the DEA is without an
that.
administrative law judge.
Yeah.
Right? We're gutting the whole system, so it's unconstitutional. And we're sitting there waiting for the administrator to act on McLooney's ruling.
Mm-hmm.
So it's going to be very interesting.
No, it is, because, I remember he retired during the whole process, and I didn't realize that was going on at the same time with it.
Yeah, we were the last case. And he reconsidered it, and he said, I'm going back to what the other judge said, and I'm just going to reconsider it. You're out.
And now he's somewhere on a beach hanging out, doing cocaine probably.
I know that bureaucracy is a thing where the right hand doesn't know what the left hand is doing.
Yeah.
But at the same time that's happening, the feet are out lost somewhere in the dark forest and don't know what is going on.
Yeah.
I think Chad is working on a new T-shirt for fuckery, but man, that's a good explanation for the whole thing.
No, yeah, you're right. That was a good T-shirt.
It's a good T-shirt.
That's a good T-shirt. But
I think this is very well coordinated. This is as simple as somebody walking into that judge's office and say, hey, let's get rid of these guys. They're giving us a pain. It's the same thing with the rescheduling thing. Why the rescheduling people aren't challenging the constitutionality of the whole process, I don't know. But I mean, we're 3/4 of the way there. Yeah.
So I guess time will only tell. I wish we had a definite answer for people, but we're still kind of going through this bullshit. And so, I'd really like to, keep people updated and everything. So if there's a time that you want to update me, just hit me up sometime, and I'll update the masses on my side at least, and try to get the information out as much as possible, because this stuff's really important. And these little small things that we think are small are actually really big things.
You're spot on. You're spot on. Yeah, because nobody says anything. It's very tightly controlled inner circle. But when you see them, I always say, don't listen to the speak, watch the action, right?
Mm-hmm. Exactly. So, there's always a difference between the two.
Right.
What you say and what you do. So I hope that something good comes from all of this in the end. There's a difference between the way things are and the way things should be. And the way things are is we're probably not going to go somewhere really good with cannabis right now, just the way our political environment is. And actually, I don't even want to talk about it on air, but an unfortunate event happened at some debate thing here in the States right before the show started, and someone got shot. So it was unfortunate.
I saw that.
And and I really hope our country doesn't start headed towards that again. We've been there before. We don't need to go there again. And my hopes and prayers out to those people. I know that people say that a lot, but I just really hope everybody's okay and everyone's safe. But I hope that's not going to be going forward the way that we do things in this country when we don't agree with each other. Because even in the cannabis side, there's times where we get in heated debates where we just can't agree. At the end of the day, it shouldn't be a bullet that decides that. Like we did that once in this country. We don't need it again.
That's right.
So I guess I'll leave that conversation there. Is there anything you want to add before we move on to the next couple of conversations there?
No, I just, we're very persistent. We know that we've done everything right by the book. We don't know why they're actually blatantly lying now and doing what they're doing, but we'll get to the bottom of it when it gets in front of the appellate court. I'm sure we'll get some favorable rulings. And I think, we look at the Pam Bondi issue with the constitutionality of our case as a positive move. And again, I'm not against the medicinal or the recreational or whatever the states want to do. They should have that sovereignty and ability to do it. But when you follow the federal playbook and you do it the way it's supposed to be done, to get met with this kind of welcoming greeting is just so inappropriate on so many different levels.
It is.
So, yeah, I'm going to expose it. I'm going to get to the bottom. We think we know who the people were that were behind this, and we're going to expose it. And I thank you in advance for helping us in that cause.
Well, thank you. This what you guys are doing is going to help the industry nationwide. Essentially, this will break open a lot of things and hopefully get us right back on track where we need to be. Because it looks like a lot of shady shit's going on that isn't legal, and it's many things in different areas. And so if we can just get one area to say, hey, this fuckery is going on over here, we should probably check on what's going on over here. That's what I want to see. And I thank you for holding them accountable, because not everybody's doing that in the cannabis industry, and they're fucking scared shitless of the government. And you guys are showing them that, fuck it, they're here for us, and they're not following their own rules and laws. Especially
and law enforcement. Congress wrote the law; they're supposed to enforce it, not keep changing it, right?
Yeah. Last I heard, the football field, the goalpost stays in the same place.
So, I put
not on a federal field.
I put one of those. I don't know if you ever saw the movie Saw.
Mm-hmm.
So I put the clown with the circle in the eyes on a tricycle up on the picture on one of my press releases. And I said, "You want to play the marijuana game?" Right?
That's the DEA talking to us there. I want to play the game. Well, Duane, thank you so much for breaking this story out to us, and I hope we get more exposure to this. And let's break this wide open as much as we can. Because as many people that there are in the industry, they need to hear about this. And what's going on, because this will probably connect a lot of dots for other people too, and maybe kind of help us all figure out what's going on in the end too. So thank you so much. And where can people find you online, and all that good stuff to find out, more information on your company and what's going on?
So we're active on the LinkedIn site under the company. The three websites are mmjih.com and mmjbiopharmacultivation.com, and then mmjbiopharmalabs.com.
Awesome. Well, thank you so much, Duane, and I look forward to continuing this conversation. We got a couple more things to talk about, and it's a kind of similarly related. A lot of corruption stuff going on in the nation, but
a lot of fuckery.
Yeah, a lot of fuckery going on. So
good.
yeah, I don't think I updated on the next one. So we'll go ahead and jump into this next one. So it looks like in Massachusetts. So here in New Mexico, we don't have voter ballot initiatives. We're not cool like that. So those are my watchers from New Mexico. Massachusetts has voter ballot initiatives, and I updated this on my page earlier in the week. And it looks like the district attorney there approved a ballot measure that's going to pretty much re-criminalize cannabis in Massachusetts and get rid of their recreational industry there. Now, the thing about that is citizens do this. They go out, they get the signatures. So it's not like lawmakers went out and did this. Could they have helped? Possibly. But, this is really a citizen-driven thing. Now, I looked up the popularity of cannabis legalization in Massachusetts. It's at 80%. And right now, nationally, we're at 65%. And actually, before this episode, I followed various people around the nation on Instagram and stuff for the cannabis industry, and I have a cat from Massachusetts. He did a lot, and so I watched the whole thing when he was on there, whole hour or whatever, while I was writing this. And he actually believes that there's a chance that this might pass because he feels that certain people in the industry there want it to go back to medical because it's just been such a mess on the rec side. It's almost like a clean slate. It's like, I think it's better, blah, blah, blah. But they're missing a key component there, that there's a bunch of other people that don't want to go back and get their card, because if they do this, that makes medical only legal there. So there's people that don't want to get their card and deal with that hassle. They just want to use their cannabis and not get punished.
Sure.
And so I kind of feel those people are in the more of the majority than the people that are like, oh, yeah, let's go back, like whatever, blah, blah, blah. So I don't know. What are your guys' thoughts on this so far?
I think it's very hard to kind of go back from what something, I mean, once you've got something established, it would be hard to kind of go back on that. But the idea that in Massachusetts, that they've got an 80% of the population in favor of what that is, it's kind of ridiculous that it even gets to the point that it's going to get to a ballot initiative.
Yeah.
It's like, how many people are going to be paying attention to go ahead and get that vote done?
Well, it's like here in Las Cruces, we changed our city zoning to allow housing all over the city. And there was a group of people that really hated it. They're like, oh, this is socialism. And I was like, this is pure capitalism. This is, I was like, I don't know what you're talking about. And they tried to repeal it so it would go to us as citizens in the next election, and we'd have to vote on it.
Sure.
And it was just a group of them. They didn't get enough signatures, of course, but that was something that they could do. So I feel it was just a bunch of people that just hate cannabis this much, and they grouped up with other people who hate cannabis that much, and maybe, who knows, maybe big alcohol's behind this too. I don't know. They were behind the Texas ban, so who knows? They probably could have partnered with these people to try to do that, because I mean, they have $1 billion industry in Massachusetts. It's a really big industry there. So I don't know. They've made their mistakes. Don't get me wrong. It's not perfect, just like every other state that's legalized it, even here in New Mexico. But I don't see a need to roll back to that, because all this will do is allow you to possess at home, and that's it. You won't even be able to grow it at home.
Wow.
So that kind of concerns me. But Duane, what do you think is going to happen with this?
Well, we put a press release out on that, the incident about a month ago, and then your scenario came up. And what would happen there was that there were several dispensaries, growers that put product out that was contaminated. And they had sent it to the labs to get analytics done on it. And the state picked up random and found out that it was all fraud. Mm-hmm. When the knowledge that I have on the federal side, the DEA is supposed to control Schedule I substances, which marijuana is, and they're supposed to protect the population of the United States from poisoning and drugs and so forth. It's their mandate. They should have stepped into the state of Massachusetts and either made arrests or tightened that up to the point where the general population couldn't be poisoned with carcinogenic materials, with pesticides. So these bigger issues are there. And you have great hypocrisy. So to answer your question, I don't know what's going to happen. But why didn't the DEA step in? Because it's a Schedule I substance and they were harming people. It's no different from what fentanyl is doing to kill people, or the poisonings, right? Why didn't they stop? They're involved now in Maine with all these Chinese illegal grows, right? So they're stepping up the activity there. Mm-hmm. You're still blocking a legitimate company trying to manufacture a pharmaceutical. You got a massive poisoning and fraud in the state of Massachusetts. Where's the federal agency? Mm-hmm. This is their mandate. Yeah. Why didn't they step in there? Are they afraid of the marijuana issue and the sovereignty of the state? But the state's still poisoning all their population. Yeah. It's really a federal issue. And where's the FDA? None of that stuff has been FDA approved. Some of them are making fraudulent medical claims without doing clinical trials. These are the bigger issues, right? Mm-hmm. Whether it goes away or doesn't, or what happens, the public is behind to have something happen in a positive way. But Massachusetts has got so many issues that they haven't addressed. And the federal government just sits by blindly and lets that happen. But yet they'll allow a bright green to come out and create $1 billion scam. Yeah. Yeah. That is crazy.
They
never put a plant in the ground.
No, never. I talked to the mayor. I had him on the show, of Grants, a few weeks back. And he was like, I had people go and try to look over their fence. There's nothing there. There's not one plant's growing.
This company hires a law firm out of Chicago. I don't want to mention any names. The law firm fronts him $2.5 million to take the company public, gets them on the stock exchange. The stock goes from 50 cents, thereabouts, pennies, to $68 within 3 weeks. They create $1 billion valuation. At what point was their representation fraud? These people never grew one plant.
Yeah.
This was just off of the DEA registration.
Yeah. And then they got kicked off the stock market.
They're out of the stock market.
Where's the SEC on that one?
Huh?
So where's the SEC on that one?
Well, I get actually I'm seeing some things filing in the federal system that they're involved now. They're involved in the bankruptcy. I mean, where did all that money go? How many people got burnt? Right? How could you make these statements? I mean, there's a thing is a looking forward statement. We all understand that, right? Mm-hmm. But at what point does looking forward become fraud?
Yeah.
They knew they never grew a plant. They knew they didn't have that science.
Yeah. Didn't you say that they were even going out of the country to get foreign investors and everything else to get some more money?
Yeah, they were having like investor parties essentially in key Asian and Middle Eastern countries to look for investors, bright green investors for to bring it here. And their sole thing was like, oh, we're going to be sending this medicine out of this country, this and that. They had like these big goals, and I was sitting there thinking, I was like, how? Like, you guys aren't allowed to do that. You're kind of just doing whatever the fuck you want at that point. Like where's the DEA on that part? Like what the hell?
I mean, they never saw this coming. They issued that registration to these people, and this is what they did with it. They surrendered their license. It's not exchangeable, so they're gone.
Yeah.
It's all tied up with all the creditors. The funny thing is that the law firm is listed in the bankruptcy for $2.5 million owed, and they're going to get discharged.
Oh man.
Oh wow.
So
yeah, that's unfortunate.
Yeah. So anyhow,
man.
As the wheel turns, but very serious situations. And you're right. When does the SEC step in?
Mm-hmm.
Yeah, like when and like it's a failure on several different federal fronts. Like it's not just one. It's like all of them blatantly just saying we don't give a shit, or we don't want to do anything to it, or we're going to allow it to do this so it gets fucked up. And then we'll intervene or something.
And then they use that as an excuse to
to do what they're trying to do now. Like, well, look at the mess that because that's a great example with Massachusetts and the recalls and like even here in New Mexico we had a testing facility called Blue Bonnet, and they're out in Texas still, and I can't believe people are trusting them over there. So this testing facility, people were sending their stuff there, but they didn't have equipment in their building here in New Mexico. They were sending everything to Texas to get tested. And then once that got found out, everyone had to get their stuff retested. So, it's just like this huge mess. And like people could have got really sick, if something got through that wasn't supposed to.
You bet.
Like that's our first line of defense, is the testing facility. Sometimes our last, not going to lie. But, I think it's been a big failure, the testing nationwide. I think I'm not going to say a scam, but it's getting close to becoming a scam. Because of how much corruption happens in the testing world. And it doesn't help us when that happens on the federal side either. Because then we run into the issues like, you're talking now, like, okay, why did they allow this to happen? But then they're allowing this other stuff to go down, or why are they cracking down on this, but not this, like what's up with this low hanging fruit stuff? And like, we even see that on the enforcement side here on the state level too. I question, I'm like, why are you guys, doing this weird shit? So I don't know, maybe it's a bigger scheme of things that's just trickling down to the state stuff now. But, I only hope Massachusetts the best of luck in the election. And I hope they defeat this, but at the same time, I really hope they go in and fix all of the issues that they've created. Because
I think that this is where the Fed's gonna inject themselves, right?
Yeah,
they're gonna come in under the fraudulent medical claims. They're gonna come in on the lab results and the fraud there. So this is a lot of other issues besides just changing it from a Schedule 1 to a Schedule 3, or for that matter, legalizing it.
Yeah.
Right.
Yeah.
So I mean, these are the issues that Trump is confronting with, as he said he was going to make some announcement within the next few weeks.
Yeah, and we'll see what that is coming forward too. We haven't seen anything yet, and everything I see so far is just bad news. So I hope we get good news somewhere. I don't care where it comes from. I just want some damn good news for the cannabis industry. So
Sure.
that's all I have for that topic. And I have one more left. It's just a quick update about Texas, and of course, this goes along the federal lines of stuff too as well. But the Texas governor, he signed an executive order to regulate the hemp products in Texas, which I think is a great move. And before the show, I obviously saw the Texas advocates and their posts, and they're all agreeing as well. Like, this is exactly what we were asking for. This is all of us wanted this entire time, is just for some kind of regulation. So what this regulation does is it's going to age gate. So they're going to ensure no one under the age of 21 is going to have access to these products, which are more than enough fair. They're also going to ensure that testing is involved, and they're going to get, now this part right here did get a couple of ears kind of pointed up, was the tobacco alcohol in Texas is going to be kind of directing towards a lot of the regulatory stuff and framework. So that's good, but at the same time, cannabis isn't alcohol, and I think we did a terrible job with regulating alcohol. So they need to understand that you can't do certain things with cannabis that you do with alcohol, because it just makes no sense whatsoever. So I think this is good news. But at the same time, it could end very terribly too.
Well, it took an executive order from the governor to do what everybody wanted them to do in the first place, which was regulate, right?
Yeah, exactly. Right? The legislature just for some reason just would refuse to do it. Like, they just Lieutenant Dan, as I like to call him, he just refused to do anything. I'm like, good Lord, man! Like, both your legs got shot off during this legislative session. You're still walking, bro. Like.
Okay.
So we'll see what happens in Texas, but congrats to them. They defeated the legislature. They kept their industry intact. New Mexico will pretty much remain the same. We're making a lot of money off Texas. About over 50% of our sales come from Texas. So it kind of helps us out that they didn't legalize it, and they didn't. I mean, if they would have banned it, probably would have made more money. But it kind of remains the same for us. A lot of operators in the state, are making some pretty decent money, near the borders and stuff. So. If they don't know that that's a ticking time bomb, though, that's their fault too. So luckily they get a little bit more time to make money, because we're a very poor state. But I don't know. What do you think about this, Duane? What's your thoughts about the whole Texas thing?
The politics are so volatile. At the end of the day, I really, people are in need of the product. All right.
Yeah.
We're so deep into the science that it's when you're manufacturing a synthetic drug, you don't know it's going to work until you get into clinical trials, right? Mm-hmm. In our case, we all know that it works, right? Yeah. What we don't know in our setup is that how much of our formulation do you need before you stop the spasticity from multiple sclerosis or stop the chorea in Huntington's disease? The only way I can find that out is to do the clinical trial. I know it works, right? Yeah. So does that mean you take ibuprofen if you're in pain? You take 2 pills or 4 pills, right? Yeah. So in our gel cap, are you going to take 2 or 4? I mean, that's subjective. You can't really control that after the drug hits the market. If somebody wants to abuse any drug, you could take it, right? Yeah. But at the end of the day, we know that it works. And the same thing with hemp. I mean, I use a hemp cream for muscular issues, and it really works.
It does. Oh my God.
Yeah, I mean, and I know it's not to the level that we've taken it, but it works. So how could you fault somebody for trying to get access to something that helps them, right? So yeah, it's a positive thing, and I hope it continues staying positive.
Me too. And then I think this happening is a win for the industry nationwide. And it's a positive news in a pool of bad news this week. So at least we have something to look up to. Because that's a huge win for the industry. If Texas went the other route, we'd have less arguments to say, hey, Texas over here who's super conservative, they decided to do this, so we at least have that argument in our pockets. Like, look, even Texas decided to regulate it, guys. Like, come on, let's stop being stupid now, because Texas doesn't do anything that the federal government doesn't do, for the most part. So we'll see what happens in the future and everything. What's going on with appropriations? Nothing.
No, I just wanted to say before we wrap up that the Appropriations Committee either is still on a break or they've adjourned for the day because the stream is still going and there's nothing going on right now. So
Okay.
I imagine that they're probably done for the day and there's not any news on the vote yet.
Okay, so unfortunately, I don't think we're going to hear anything on the Appropriation Committee probably tomorrow, next couple of days, whatever. But once I do, I will keep you guys updated. I will post it on my socials. So make sure you guys follow those, like, subscribe, whatever you got to do to stay in the know. Duane, thank you so much for joining me today. I look forward to, hearing all these updates and everything what's going on. And I look forward to, blasting this, story as far as possibly we can, because it's very important what you guys are doing. So thank you so much for joining me. And do you have anything to say before we leave?
Appreciate you, and thanks for your help in getting the message out. We're very persistent, and we'll prevail.
100%, man. And we're going to keep fighting for cannabis because we're cannabis warriors. So, Gino, you got anything for head out?
No.
No?
No, I'm good.
All right, guys. Well, thank y'all so much for watching this week. We'll be back again with another episode of #GrassyLogic next week. All right, guys. Shoot.